Good day and welcome to our monthly webinar. Today's webinar is titled Catching On to Sun Safety with MD Anderson's Sun-Beatable's Preschool Program. My name is Peter Cribb and I'm the Catch Program Director at the Catch Global Foundation and previously with the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health, Austin Regional Campus. Once again, we're very excited about today's webinar, but before we get started, I'd like to take care of a little housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the catchinfo.org website, along with the PDF of the presentation slides. During today's webinar, we encourage you to type in questions and comments via the questions box, which you can access through the control panel on your screen. You can type in your questions at any time, but to keep us on schedule, we will try to hold off answering them until the Q&A portion at the end of the presentation. Next, I'd like to share a little bit about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families, and communities. Our work fosters improved health behaviours among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. Our vision, healthy children in a healthy world. Now I'm delighted to introduce our special guests for today's webinar, Mary Tripp, Lisa Cummings, and Duncan Van Dusen. Mary Tripp is an instructor in the Department of Behavioural Science in the Division of Cancer Prevention and Population Sciences at the University of Texas MD Anderson Cancer Center. Dr. Tripp's research is focused on the development, implementation and evaluation of interventions to reduce skin cancer risk. This research has included the development of behavioural interventions for the community, as well as cancer survivors and their families. Dr. Tripp is a co-leader of MD Anderson's Melanoma Moonshot Prevention Flagship Program, which emphasizes behavioral, educational, media and policy interventions to reduce ultraviolet radiation exposure in children and adolescents. Welcome, Mary. Lisa Cummings has been in the healthcare field for over 19 years. Lisa has attained her bachelor's degree in nursing from Loyola University of Chicago and a master's degree in health promotion and behavior from the University of Georgia. Since 2006, Lisa has been part of the Kishwaukee Health System and for over 7 years, a pediatric registered nurse in the community and wellness educator. In 2010, Lisa was given a full-time role as a community health liaison for the Kishwaukee Community Hospital to help improve health of the Dekalb County. With childhood obesity as a focus for this county, Lisa has become the catch trainer for both Catch Kids Club and school-based catch in 3 school districts. Lisa coordinates the catch program and works closely with Northern Illinois University students to bring catch to the classrooms, after-school programs, and summer programs throughout the community. Welcome back, Lisa. Duncan Van Dusen is the founding executive director and member of the board of directors of the Catch Global Foundation. Duncan holds an AB from Princeton University and a Master of Public Health from the University of Texas. He has over 20 years of leadership experience in both the for-profit and non-profit sectors. Outside of work, Duncan spends time with his family traveling, playing tennis, learning Spanish and Chinese, and experimenting with novel communication strategies to convince his daughters to exercise and eat their vegetables. Welcome, Duncan. Today, our guests will discuss the University of Texas MD Anderson Cancer Center's Ray and the Sun-Beatables, a safety program for preschoolers. Over to you, Mary.
Thank you, Peter. It's great to be with everyone today and to have the opportunity to talk about MD Anderson's Sun-Beatables program. Next slide. I'd like to start today by talking a little bit about the importance of developing sun protection habits in early childhood. The statistics show that skin cancer is a significant public health problem in the United States. About 5 million cases of skin cancer are diagnosed annually. The number of new cases of melanoma, the most dangerous type of skin cancer, increases about 3% each year. At least 73,000 new cases of invasive melanoma are expected to be diagnosed this year alone. Research shows that ultraviolet radiation, also known as UVR, UVR exposure from the sun or indoor tanning devices is a major risk factor for melanoma, and sunburns during childhood increase an individual's lifetime risk of skin cancer. Next slide. The challenge is that studies show that about half of children and adolescents experience at least one sunburn per year, and only about 10% of high school students use sunscreen routinely. Positive attitudes towards tanning or having a tan also develop during childhood. These findings emphasize the importance of starting in early childhood to educate children and their teachers and parents about skin cancer prevention to help children develop sun protection habits. Next slide. One health behavior theory that has been found to be an important guide for the development of sun protection programs is social cognitive theory. In this theory, an individual's health behavior influences and is influenced by factors within the individual and the environment. In the case of sun protection, environmental factors could include school sun protection policies and availability of shade on the playground. Factors within the individual could include knowledge, skills, and confidence to perform sun protection behaviors. All of these elements are critical and form the basis of our Sun-Beatables program. Next slide. MD Anderson has developed the Sun-Beatables program, which is evidence-based. The theme of this program is that sun protection is a superpower. Through the curriculum, children meet superhero characters, Ray and the Sun-Beatables, who travel around the world using their superpowers of sun protection. Next slide. This slide shows Ray and the Sun-Beatables. Each Sun-Beatable superhero represents a sun protection behavior. And all sun protection behaviors are important, so the Sun-Beatables work as a team. Ray, in the top left, is the leader. He has the superpower of shade. He also knows when it is safe to be outdoors. He wears a magic watch that reminds him to be super protected during the middle of the day when shadows are shorter and the sun's rays are more harmful to the skin. The other Sun-Beatables, Serena, Chloe, Stefan, and Hannah, also have superpowers. They have the superpowers of sunscreen and protective clothing, sunglasses, and hats. And we use these Sun-Beatables characters to represent sun protection behaviors not only in the curriculum, but in parent education materials and teacher training materials. Next slide. The Sun-Beatables program itself includes a curriculum and music CD of sun safety songs, as well as teacher training and parent education. The program also provides visual displays for schools, such as posters, as well as guidance on how to create a sun protection policy at the preschool. We include a policy template that schools can refer to or customize for their needs. The Sun-Beatables program also provides technical assistance for any questions that preschools may have. Next slide. The goals of the curriculum are for children to express why sun protection is important and to demonstrate how to protect their skin from the sun. As you can see in this photo, we really emphasize role modeling of behavior. We like kids to develop the confidence that they can use sun protection behaviors and also show these behaviors off to their peers who can see the positive reinforcement that children receive for practicing these behaviors. So we also recommend a comprehensive approach to sun protection. So while you don't see sunscreen in this photo, we do recommend applying sunscreen to all areas of skin not covered by clothing, wide-brimmed hats, sunglasses, and of course protective clothing with sleeved shirts and longer shorts or pants. Next slide. Role modeling and positive reinforcement are key components of this Sun-Beatables program. Teachers are encouraged to serve as sun safety role models to children and their parents. Children also have opportunities to practice and role model sun protection behaviors for their peers, as I mentioned earlier, and also for their parents and teachers. The program includes parent communications, tips, and resources to update parents on what their children are learning in the classroom, but also to encourage parents to practice and role model these sun safety behaviors at home. Next slide. The Sun-Beatables program continues MD Anderson's dedication to preschool sun protection. In an earlier study funded by the National Cancer Institute, we conducted a group randomized trial in 20 Houston area preschools to develop and evaluate a sun protection intervention program. We compared the sun protection intervention that we developed with standard education available in the community. The results of our study show that our preschool sun protection program works. The program had positive effects on teachers' behaviors to protect the children in their care. In preschools assigned to the intervention program, teachers practiced sunscreen and shade behaviors for children significantly more frequently than did teachers in the standard education group. Also, children in the intervention group wore hats and protective clothing significantly more frequently. And the publications are listed at the bottom of the slide and will be available when you look at the PDF later. Next slide. In preschools assigned to the intervention, teachers also had significantly higher levels of sun protection knowledge. Teachers had significantly higher levels of self-efficacy or confidence in their ability to use sunscreen, protective clothing, and shade behaviors to protect children. Teachers in the intervention preschools also reported stronger norms for using sunscreen. Next slide. Next, I'd like to give some examples of activities from the Sun-Beatables curriculum to show how we incorporate role modeling of behavior into the curriculum activities and how we teach sun safety concepts. Next slide. Are Our Shadows Long is an activity that teaches how you can use the length of your shadow to understand when the sun's UV rays are most damaging to your skin. Children learn that during early morning and late afternoon, shadows are longer and it is safer to be outside. During the middle of the day, the sun is directly overhead and UV rays are most intense and most damaging to the skin. Children can see that their shadows are shorter at this time of the day or they don't have a shadow. The curriculum emphasizes that children be super protected during this time of the middle of the day. Next slide. In I Spy a Sun-Safe Superpower, children classify items as sun-safe or not sun-safe, and the teacher role models sun protection behaviors and provides positive reinforcement for practicing these behaviors. As you can see in the photo, some of the behaviors that they were talking about in circle time were wearing sleeved shirts, sunglasses, using sunscreen, and wearing a wide-brimmed hat. Next slide. In the clothing flashlight test, children use a flashlight to represent the sun to see if clothing fabrics are tightly woven or loosely woven. Children learn that tightly woven fabrics are more protective as they can block more of the sun's rays. In the photo, we're looking at fabric that is more loosely woven, so you can see the flashlight shining through the shirt. Next slide. The curriculum also includes a sun safety parade to give children and teachers an opportunity to role model sun protection behaviors for others and to receive positive reinforcement. You can't see it in this photo, but as the children and the teachers rounded the corner, they were met with applause from their fellow students and other teachers in the school. So we love to make these activities school-wide events when possible. Next slide. It's important for us at MD Anderson to continue to evaluate the Sun-Beatables program so that we can be responsive to any questions that teachers or preschool directors or parents may have or any challenges that they may face in the areas of sun protection or skin cancer prevention. Next slide. During this past summer, we conducted a pilot study of the Sun-Beatables program. MD Anderson recruited 6 preschools to participate in this study, which gave us an opportunity to observe firsthand how preschools are using the program. We conducted interviews and surveys with preschool directors and teachers, as well as brief interviews with parents. We conducted classroom observations of curriculum activities and also playground and pool observations of sun protection to identify any areas for improvement in the program to better meet the needs of preschools. Next slide. This slide includes just a few of the comments that we received during this pilot study. I won't read these quotes, but feel free to read through them. We found that the children really enjoyed the superhero characters and communicated the sun protection messages represented by those characters to their parents. The children also reminded their teachers about sun protection while they were at school. Communication between teachers and parents, and also communication between children and parents, are keys to this program's success. Next slide. We are currently analyzing data from this summer research pilot study to enhance the Sun-Beatables program. Version 2.0 of the Preschool Sun-Beatables program will be available in spring 2016. Next slide. Before I close, I'd like to take a moment to thank and to recognize the Sun-Beatables program team and the Melanoma Moonshot at MD Anderson. The Sun-Beatables program is supported by generous philanthropic contributions to MD Anderson Cancer Center's Melanoma Moonshot program. So I thank you for attending today, and I look forward to answering any questions that you may have in the Q&A session later. Thank you.
Thank you, Mary. My pleasure now to introduce Lisa Cummings.
Well, good morning. Again, my name is Lisa Cummings, and I am the Community Health Liaison for Kish Health System in Dekalb, Illinois. And Mary gave you a little bit of background about the data and really how the Sun-Beatables program came to be. I'd like to share with you a little bit about what the Sun-Beatables program looked like here in Dekalb County at some of our facilities. Ironically enough, we just completed our community needs assessment here in Dekalb County, and I think to all of our surprise, the incidence of melanoma had risen dramatically. And so it was really kind of neat to bring this program over the summer, knowing that this was going to be an initiative that we were going to have to address. And so being a part of Catch Global and implementing the Catch program, having this program also was going to be a big positive for our community. Next slide. Back in May of 2015, I was able to, with the support of our health system, to go to Austin, Texas, and train for the Sun-Beatables program. And being part of a health system, I think this was a perfect opportunity to bring a program like this back to our county. And so after the training, we were then going to come back to Dekalb County and look at some sites that we wanted to pilot the program. Next slide. Looking at the different sites to implement the Sun-Beatables program, a couple of the sites were really easy for us because we have such a good relationship. For example, with the Kishwaukee Family YMCA, they implement the Catch Kids Club, also the summer Catch program as well, and pre-K. And so they definitely were a site that we wanted to partner with, in addition to the Genoa Park District program that also uses the Catch program. And so having that close relationship with them, we were really able to work well together over the summer. We also chose a preschool setting that we were not as familiar with, and they had younger preschool students there. And so this was a new site that we were working with, and they actually wanted to implement it a little bit later in the summer into early in the fall. And so we had a very nice, diverse group of preschoolers and sites to be able to implement that program. And as you can see in that picture, we have our Blue Lizard sunscreen. So shout out to Blue Lizard because it definitely was the talk of the summer. They have the fun patented smart bottles that when the sunscreen is out in the UV light, they change colors. And so this was a very fun part of our summer for the kids. Next slide. Incorporating the Sun-Beatables during the summer we thought was a very important time because we know summer is a perfect time to start talking about sun safety. Many of those sites that we worked with, they were swimming every day. There were many field trips where the kids were outside. And so we knew that this would be a great time to educate our little ones and our parents. Next slide. We chose different age groups within the preschool age range. Our Kish Family YMCA definitely had your traditional 4- and 5-year-old preschoolers in their program. The Genoa Park District, they had older preschoolers, but they also had some kids that were a little bit older that I'll talk a little bit more about how they actually became involved with the program as well. And then the Growing Place had our youngest preschoolers, which were our early 3-year-olds and newly 4-year-olds. And so it was really neat to see the different age groups in those categories, the different activities that they really liked and enjoyed. And so I'll share more with that in just a little bit. Next slide. Our sites really love the flexibility of the Sun-Beatables program. The way that the program was broken down is there were 5 units in the Sun-Beatables curriculum, and each one of those units had 4 to 5 activities. And with each section, there were preparation tables for each unit that really helped our sites plan for that week. The flexibility of the program, some of our sites did 1 activity per day, and they were done with the program in 5 weeks, where some of our other sites did 2 to 3 activities a week, and they took the entire summer, 10 to 12 weeks, to actually finish the program. And so, again, that flexibility worked differently for each one of the sites, and they fitted into how they thought it would fit well into their program. The other area of importance is that the content learning areas adapted are from the Head Start Child Development and Early Learning Framework. And so our educators really liked having that background. And so we knew that there was a multitude of learning areas, including art, language, science, math, and also social studies. So the kids really didn't feel like they were learning because they were having so much fun. Next slide. As Mary had stated, one of the big components of the program are definitely the Sun-Beatable characters, and it was very interesting to watch and see how the kids identify differently with all of the different characters. And so I don't want to repeat what Mary had said, but Ray having the power of shade, and he was definitely the leader. Serena, power of sunscreen, Hannah with her protective hats, Chloe, her protective clothing, and then Stefan for the protective sunglasses. And so many of the boys thought they were really cool if they could be Ray or Stefan, and we had many, many girls fighting for that role to be either Hannah, Serena, or Chloe. And so they really identified with what their superpower was, and I thought that this was a very powerful part of the curriculum and keeping the kids engaged. Next slide. The fun hands-on experiments were also a very big part of the summer. You know, summer's supposed to be fun, and of course, you know, kids don't want to necessarily think that they're learning, but these hands-on activities really engage the kids. And there were a few different activities I think that Mary had referenced to. Serena's sunscreen experiment. This was very, very impactful, and especially for our older kids, our 5- and 6-year-olds. And that experiment is looking at why is it important to reapply sunscreen when you're sweating throughout the summer or you're swimming. And so our bigger kids were involved in that experiment as well. The sun safety hat with Hannah was fun, where the kids actually made their own sun safe hats with really colorful duct tape and newspaper, and so it was fun to do that with the little ones. And then Chloe's flashlight test. This was definitely very eye-opening for many of the kids, and they would do the experiment of looking at different types of tightly woven clothing or lighter clothing to see if the light went through that clothing and if it was indeed sun safe. And so everybody was fighting over wanting to see who would get the flashlight. So we did this many times throughout the summer. And then I had to put Blue Lizard sunblock on as far as our hands-on experiments because, again, the kids they really liked taking the bottles outside and seeing if they were in the UV light and if the bottles changed colors. Next slide. As Mary had stated, this was an experiment that she had referenced to called Our Shadows Grow Long. And at one of our sites, this was our younger preschoolers, and we didn't have a super sunny day that day, but we still went outside and we drew our shadows. And the kids were very, very excited when we came back out and they had seen how their shadows had, changed in length. And so we actually had to do this a couple times throughout the summertime because they wanted to see if it would change throughout the summer. And so they really were smart little ones. And so we had fun with this experiment. And we purposefully did this experiment right outside where the parents would pick up their kids so that they could ask about what that experiment was all about. Next slide. There are many activities and songs throughout the curriculum. This slide shows the puppet shows, and we did some sun safety songs. One of the first puppet shows was called Making New Friends, and you can see some of those little ones holding up some of the Sun-Beatable characters. And again, we had to make sure everybody got their turn with their favorite Sun-Beatable, so we did this one many times through the summer. But this actual puppet show was an intro of the characters throughout the curriculum and really the journeys that they were going to take. You can't see this in that video, but there's also a raised corner, which is a sun safety play center where parents brought in different types of sun-safe clothing, sunglasses, hats, and this was really a role play center where the kids were able to pretend to be their super heroes and to show that they could be sun safe as well. The sun safety songs, there were many favorites. Definitely you can see the quote on the bottom, "Are you sun safe?" What I loved about the songs were that there was a lot of repetition, and with the little ones, I think that's really what helped them to memorize those songs throughout the summer, and you found that many of them hummed that throughout the day in addition to the adults. The role modeling during the songs from the teachers using their hand signals and acting out different ways to be sun safe, the kids really picked up on that as well. And so it was very, very...
I forget what it is. Sandwiches on pretzel roll.
Hello?
Yeah. No, that's good. You can have it ready at like 12:20. Yep. All right. Thank you. Bye.
Peter, can you hear me?
Yes, Lisa, I think we're just getting a little bit of a
Should be fixed now.
edit here, but I think we're fixed now. Go ahead. Thank you.
Okay. And so in that second picture, you can see Ray's world map. And this was part of the program where the kids were actually able to take adventures with their superheroes to different areas around the world. And they actually had a passport that they could have different Sun-Beatable stamps put into their passport to show where they had been during the summer with their superheroes. And with all of these activities, the curriculum had many, many parent connections in the program, which were really key, I believe, throughout the summer and communicating with the parents about what their kids were learning and how they could reinforce that at home. They also gave parents communication tools. There were note cards that could be sent home. And so I felt very good about that parent-child connection with the Sun-Beatable program. Next slide. For this site, we had a champion site, and that was at our Genoa Park District. And at the end of their program, they wanted to have a graduation. And so we made certificates, and the kids, after they had made their sunglasses. They wanted to get together and take a picture, and then we individually took pictures of them and their certificates so that we could frame them and give those to the parents. And of course, because Blue Lizard, the sunblock, was such a big part of our summer, we put the kids next to that. They wanted to take a picture with that next to them. Next slide. At the end of the summer, many of our sites had, like Mary had stated, the Sun Safe Parade. And we sent out letters to all the parents to tell them about the parade and the different characters. And the kids specifically chose who they wanted to be, which superhero they wanted to be. And so we decorated, with the help of some of our adults, decorated some signs and colored some pictures and let everybody know about the parade. The kids got dressed up from items from Ray's Corner, and we paraded from classroom to classroom. We also went outside, and that actual preschool site is next to the Dekalb School District office building. And so many of the administrators were coming out and asking what it was that we were doing. And they were very, very happy to see the kids making some safe and healthy choices. And this was really a great way to end the curriculum with the Sun Safe Parade and putting it all together in everything that they had learned. So in conclusion, for my part of the webinar, we know that summer is supposed to be fun, but it's also supposed to be safe. And so again, being a part of a health system, and this is what we do for our community and trying to improve the health and wellness of our children and our families, I'd like to thank MD Anderson for bringing such an important health topic to our little ones. And we hope that we can continue to bring this to other parts of our county next summer and throughout the year. Thank you.
Thank you, Lisa, and thank you for sharing. Looks like you were having way too much fun, almost more fun than we had at training. It's now my pleasure to introduce Duncan Van Dusen and talk to you all a little bit more about the program and how it can work for you.
Great, thank you, Peter, and especially thank you, Mary and Lisa, for your presentations. You guys are a tough act to follow. So I just have a few words that I wanted to share about some of the mechanics of the program and what we provide and what we ask for community centers and child care centers to provide. And then we'll go in about 5 minutes and take some questions. So first of all, in terms of the pricing and how we're offering the program, MD Anderson is very generously subsidizing the program. During the pilot period, it was essentially entirely free. This year, it's still heavily subsidized. We're doing as much as we can to make it easy for you to roll it out. So we will provide the training on site in your community on a mutually agreeable date. And all we ask is that you cover our travel costs. So really, it's a function of how far you are from either where we are here in Austin or one of our trainers like Lisa, who happens to be in Illinois. So we'll find the closest trainer that we can, and we'll just ask you to cover their travel costs. The training, by the way, is a half-day training, 4 hours. So we can do that on a teacher development day. It could be after your session's over on a late afternoon, early evening, or it can even be on a Saturday, whichever is best for you. In terms of the curriculum itself, we ask that the community cover $50 per curriculum toolkit, and we generally recommend 1 curriculum toolkit per classroom. And the curriculum toolkit has a number of elements. It includes the curriculum and teacher's guide, which has the units and activities that were referred to. It has a children's music CD. It has a number of accessories, including the character cutouts that you saw, the world map that you saw. So all the stuff that you saw in the presentations is part of the curriculum toolkit. And then it also has a great training guide with some parent education materials and school materials. So it's really very, very comprehensive. I think it's a retail price of about $200. And like I said, thanks to MD Anderson's efforts, we're able to make it available just for $50 per classroom. We are able to subsidize about 100 sites during this coming spring and summer season. And I think already we have approximately 20 of those spoken for. We will probably fill up most of those by the end of the year, by about December 31st or maybe January. So if you're interested in being one of the sites that receives that subsidized pricing, please let us know, and we'll try to get you enrolled before the end of the year. If we have more demand than we can satisfy with that, we certainly will make the program available to more sites, but we may not be able to subsidize more. The training will start in Q1 of 2016, so we already have 3 or 4 training dates on the calendar in January and February. Some communities, particularly down in this part of the country, when preparing for spring programs, January and February is the planning time, and a lot of these sites will probably be rolling out in March, which is really capital S spring down here in Austin in terms of sun exposure. Other sites, especially year-round sites, may decide they want to train a little bit later in, let's say, March or April, and roll out in May, and that's fine too. So we can be flexible there. But again, the sooner that we plan, the better. Next slide. So in terms of what we do and what we ask or recommend for the child care centers or preschools to do in order to have a successful program. So like I said, Catch and MD Anderson will provide a half-day training session on site wherever you are. We'll provide the curriculum toolkit and the training materials at the training. So the teachers that come to the training will be getting their curriculum. They'll be able to walk through it. We'll show them all the different pieces and parts. They'll be able to put their hands on, and then they can go back and start teaching it or using it immediately. And then, of course, we're here to provide technical assistance, both by phone and email, whatever inquiries you have, questions that come up from parents or children that you don't know how to answer. We're here to do that. And of course, we have a great network of folks like Lisa who have implemented the program themselves, who have a lot of practical knowledge about what works and what doesn't work. The things that we ask you to do include, number one, to identify one sun safety champion per site. So this is somebody who is really interested in the program content and in the concept of helping kids to be sun safe, that can really be an advocate and evangelist with parents, with other teachers, and make sure that the program is implemented as well as it can be, and that you're coming up with new and creative ideas. And I'm always humbled when I go out and see community sites and see what they've done with the program. They make up their own activities for the kids. One site that I saw had life-size coloring cutouts of some of the characters. Lisa mentioned they had a Ray corner. So it's just great what folks come up with. The second thing that we ask of you is to recruit your organization leaders, including the Sun Safety Champions and whatever preschool teachers are going to be, classroom teachers are going to be teaching the program, to attend the training. And the most important part of that point is perhaps organization leaders. If there's a center director or program director, child care director, it is so helpful to have that person attend training. I know 4 hours is a big commitment of time, but having them understand what the kids are learning, what they're going through, what the basis for the program is, why it exists, what its results are, that's tremendously, tremendously helpful to the champion. It's tremendously helpful to the sustainability of the program and to the communication with the community, the wider community, including the community of parents. In terms of the frequency of the lessons, we recommend and ask that you plan to teach at least 2 sun safety activities per week in each classroom. So keep in mind, some of these are very short. Some of them might only be 5 or 10 minutes. It might be just a song that you sing at circle time or at transition time. Also, because as Lisa mentioned, this age group loves repetition, and so it certainly is fine to teach the activities that the kids like more often than once, and that's great because that really reinforces the behaviors. Although obviously most communities will probably stress the curriculum during the spring and summer, we do also recommend and ask that you promote sun safety year-round. So those behaviors, especially if you're in the Sun Belt, are really year-round behaviors, and so it's really important to keep the program signage and displays and reminders for teachers and parents up at all times, and keep the children immersed. And Mary talked a little bit about the theoretical basis for the program, which is the social cognitive theory, and the importance of the environment. And all those of you who use Catch, of course, are well aware of the value of having the Catch messaging and the Catch environment year-round, and we recommend the same thing with Sun-Beables. We also ask for our reporting that you are able to fill out some very simple demographic information that we ask for and participate in some program evaluations. As Mary said, we're working hard to continue to improve the program. And so the best way to improve it, of course, is to hear from people who are using it. And we were very flattered to have dozens and dozens of survey responses to the surveys that we sent out for the pilot group, and some extremely helpful feedback that people took the time to give us. And I think we're going to make some great improvements to the program because of that. And then finally, nothing is more important than communication. And in this day and age of high media environment, if something isn't recorded, it's almost like it didn't happen. And so we really appreciate anyone who sends us stories, pictures, and videos, the kind of stuff that you captured, for example, Lisa. That's phenomenal. It gives people a really good idea of what Sun-Beatables looks like in action. It gives parents a good idea, it gives other teachers a good idea. Here's what it's supposed to look like. And it's particularly important because, again, we're trying to create an environment that's conducive to sun safety. So, I remember when my kids were little and they'd come home and I'd say, "What'd you learn in school?" And they'd give me a blank stare and say, "I don't know." And for a while, I guess I thought, well, maybe they really aren't learning anything. But of course, I soon found out that it's not that they're not learning anything. They just don't play it back when you're expecting. And then all of a sudden they would say something and I'd say, "Wow, where did you get that?" But it's incredibly valuable to be able to keep parents in the loop so they know what the child is learning, and so they can see, like Lisa mentioned, seeing the sidewalk chalk, seeing posters in the hallways. We had one community that told us that they were sending out semi-cryptic parent notes to get the kids to talk with their parents about the program. So those are all things that you can help with, and if you get the media's attention in your community, that's even better. So finally, last slide. Here are the addresses where you can go to get more information. You can visit our Catch Info page on UV protection, or you can email us at sunbeatables@catchglobalfoundation.org. So thank you again for your attendance and your attention, and now we'll take questions.
I remind everybody, if you have a question, please feel free to type that in now. We do have a couple of minutes for questions. I've got one for Lisa right now, actually, if you wouldn't mind, Lisa. We've seen how the kids have responded to the teachers' work. How have the parents responded?
Well, the parents in the beginning, I think it was a matter of us really communicating what this program was all about. And so we really tried hard to, just in little bits and pieces, to get them involved in any way that we could. The first, one of the first things that we did after we sent out a letter to all of the parents was, if there were any items at home that they could contribute to Ray's Corner. And so that was a way for them, to be invested in that as well. And we also offered for them, if they would like to come in and watch some of our lessons and to be a part of that as well. When it came to the end of the summer and we had our parade, we felt pretty good that many of the parents came and actually helped us to prepare for that. And so I felt like we really gained their trust. I felt that, they felt a little more invested in the program. And so it's important that we utilize those parent connections, because if we don't, like Duncan said, if we don't use those, then they're not there. And that's what they're meant to do. They're meant to connect us to the parents. And so we need that message not only in the school, but we also need parents talking to their kids about it at home. And that's when we know when behavior, changes.
Lisa, got a question from Oregon. I am a duck, actually, and I might throw this one to Duncan. Duncan, requests there about perhaps train the trainer.
Yes, we do. Thank you for asking that question, and I neglected to mention that. We do have a train the trainer model, and we used it very successfully last summer. Lisa was, as she showed in one of her slides, was one of the attendees at our train the trainer session. So shoot us an email if you would, and we'll talk with you and arrange what the best way to do that is, whether we may have another one here in Texas in the spring. We may be able to bring the train the trainer content to you. But yes, we do have a train the trainer model. We'd be happy to. In fact, we love doing that because obviously that'll help you guys create capacity and be able to help sustain the program. And anyone who has the ability to have a staff trainer, that would be super.
Great. Thanks, Duncan. Actually, one more, Lisa, and I guess just from my perspective, because we're taking this back to our staff after training, of the staff that have been trained. How have your staff responded?
How did the staff respond when we
Mm-hmm.
brought? Yeah, well, I think it helped that the sites that we did choose, they are definitely supporters of a lot of the programs that, we support here with the health system. I think they loved getting this beautiful kit that had all of these resources. I mean, these are puppets they're beautifully laminated. They're colorful. The stamps and the map, and teachers, they work on a shoestring budget. And so, when I brought this curriculum and we went through it together and it was all laid out for them, that was really the selling point. And every one of my sites was very, very excited to implement it. I didn't feel like, it was one more thing for them to do. They really actually enjoyed having a program like this during the summertime to be able to bring to their kids.
Thank you, Lisa. This question, perhaps best for Mary, and I'm assuming here that Ms. Davis is already using the program. She's wondering, how can we get more posters?
Okay, that's a great question, because we're actually in the process of designing some additional elements for the version 2.0 of the Preschool Sun-Beables program, which will come out in the spring. And one of the items that we were looking at were the posters. And so is the question about how to get more copies of the same posters, or will there be new additional versions of posters in the future? If it's about new additional versions, we expect to roll out some different designs over time. If it's about receiving multiple copies of the same poster, we can certainly work with individuals to see what those needs may be. I think that this initial rollout this past summer has been a great learning experience for us as we really assess demand for the program. So if there's a demand or need for more copies of an individual poster, we're happy to look into how we can provide that.
Great. So, Ms. Davis, if you'd like to email me directly, we can work with you to help there. We've run out of time, and I really want to thank our special guests today, Dr. Tripp, Lisa Cummings, and Duncan Van Dusen. I'm excited about the program. I grew up in Australia, and we're not unfamiliar with the issue of sun, and I'm excited to be able to be part of helping our little ones learn those healthy habits. And thank you all for your efforts to help and support and create healthy environments in the preschool setting. We look forward to our next webinar. Bye for now.